Hi, Dr. Pelto here. I'm going to go over something called my Wart Treatment Evaluator. This is something I put together because I find that when patients come in, there can be a lot of confusion about how to treat warts. And specifically, I'm going to speak of my new favorite method. But before I even begin, I just want to say that I think combination treatment can improve effectiveness. So I'm not saying any one of these. No, these are all going to be non-surgical options for treating warts. There is surgical options. I sometimes say if there's one wart, you can just remove it. Sometimes it's quicker. But if there's numerous warts, if there is something called a mosaic wart, it can be more of a challenge. So what I have here is a scale, effectiveness scale. So there are certain things that are most effective and others that are least effective. And then I talk about effectiveness, discomfort level, and complication. I want to emphasize, start with complication. There are some mild complications, but really no lasting complications. It's more in the discomfort level and in the basically ineffectiveness of the treatments. But let's talk about the treatments. I'm going to start with the basics that most people may have tried before, which would be a salicylic acid. Salicylic acid you can get over the counter. When you see a doctor, there might be a slightly a stronger variant of it, the percentage of the salicylic acid. When do I use salicylic acid? I use it when the wart looks like it's almost gone, and I'm not really sure if there's any wart there, and I'm going to see a patient back. That's when I use salicylic acid, or I might use it in combination of another therapy. Very rarely do I use it as a standalone therapy. I did not include cryotherapy here because we don't do it in the office. A lot of times primary cares might do it, dermatologists do it. I'm just saying what I use currently in the office. Carac and Aldera. Aldera is used for warts, genital warts, using it off-label. Carac is 5-fluorouracil, which is used for sloughing off skin for skin cancer. Both of these, they're helpful. I do them under occlusion. What that means is you take and you put it on the wart, and then you cover it with like a Band-Aid or plastic wrap or something like that. Once again, I tend to not see it that effective in isolation. It tends to work better in combination. So my combination tends to be Carac topically, Cantharidin, and then Swift, or either laser and Swift. And I want to explain kind of going up here about these two. The main benefit to using laser is that it hurts during. I know that's a bad benefit, but it hurts during the treatment, but it doesn't hurt after. So it creates a blood blister. The laser creates blood blister. And the Cantharidin doesn't hurt, so it works really good for kids, for example, because it only hurts afterwards. So it's going to hurt for 3 to 5 days afterwards. It's going to create a blister. So the Cantharidin creates a chemical blister, and the laser creates a blood blister. So that's the main difference. And I want to spend a little bit more time talking about the Swift therapy. It's not really surgical removal. What it is it removes it by creating a microwave trauma to the skin. It's not really destroying it. It's stimulating your immune response. And so what I'm intending to do now is a combination therapy. So I'll do Swift therapy once a month, along with either Cantharidin and laser. And then after a little bit, patients can use the Carac or Aldera. Just try to get it gone quicker. Why am I doing that? Well, with laser and Cantharidin, even if there's only one wart, I'm tending to find I'm having to do over three sessions. Let's say 3, 5, 7, sometimes 10. It really depends on the patient, on their immune response, and what they can tolerate. What the research shows with the Swift is it usually is around 3 treatments. So it's a lot less treatments. The drawback of the Swift is that it's not covered by insurance usually because it's not lesion destruction. It's creating an immune response in your body. And for that reason, it's not covered. So some people say, well, it's expensive. But I think of, well, coming to see me 3 times is better than coming to see me 8 or 9 times in terms of your time and the effectiveness of the treatment. That's why I like the combination. Going a little bit deeper into the Swift, it's about 85% effective with an average of 2 to 3 treatments. That's the nice thing. It's a lot less visits to come and see me. I took a while before doing this, and really the rationale is because in our kind of like practice model, we were seeing patients back, but it gets a little frustrating because they're not getting better. They eventually are getting better, but it's just a lot of visits, and those can be painful visits, whether it be with the laser at the time we're doing it or the Cantharidin afterwards. Normal warts, we have a very low recurrence rate, but they say that with the traditional treatments, it's 10%. With this, they say it's a 1%. And what this microwave therapy does is it goes all around it and injures all the tissue around it. It uses low-dose microwave energy delivered to the skin. The tissue temperature is rapidly increased, and your body is alerted. So your body's gonna attack the virus, and the treatments are 4 weeks apart. So traditionally, we're seeing patients every 2 to 3 weeks, and now we're seeing them 4 weeks. And then so you'll do the 3 sessions, and then usually a 3-month follow-up after the final treatment. So that is how that works. Here are some before and afters. These could be seen with anything that we do, but here are some before and afters here of patients with warts, and you can see kind of the timeline before and after. Here's one on the side of the toe, before and after. The front of the foot. Now, these are very painful. This is a very big mosaic wart before and after. So this is a new treatment for our patients. I thought you would like to learn about it. If you're interested, I'm going to put some information under this video. You can just text our office SWIFT, or you can look for a doctor that offers this in your region if you're not in the area of Massachusetts. Okay, thanks.